Okay, so we're going to go over one of the important acupuncture points known as bladder 10, which is located at the base of the skull. Bladder 10 is usually actually located within the hairline, about half a chun, and it's usually located at the base of C1, which is basically at the base of the occiput, just below the C1 spinous process, which you can't really feel, but it's right below the divot at the base of the skull, and it's about 1.3 chun lateral to that tip of the spinous process of C1, which is hard to feel, so we're just going to use the actual trap muscle itself to landmark it better. And the way we actually find the bladder 10 is actually, you find the depression at the base of the skull and you follow your finger lateral just to where it falls off of the trapezius muscle. There's some other points here for reference. So if we look, we have gallbladder 20, which is in line with GV 16, and which is between the base of the occiput and C1, and between C1 and C2 we have GV15, and bladder 10 is in line with GV15. So if we go lateral just to where it falls off the trap, the point is located approximately right there. The insertion is about 0.5 to 0.7 chun. It can either be perpendicular, directly in, or slightly oblique towards the spine. And you just want to make sure you don't go superiorly towards the base of the skull. I'm just going to insert the needle. Good. Now, this point is a great point for headaches, or especially headaches that refer pain into the side of the head or even into the back of the occiput. It's also great for headaches which have a suboccipital component. It's also very good for individuals who have difficulty with neck rotation. And lastly, it's also the motor point, or the semispinalis capitis, so it's very good for headaches where you have a lot of tension within that muscle.